Hello all, this is Jess Hoy again from Winona State University, and I am recording a presentation on influenza and again on pneumonia today too. So this will be divvied up into little chapters out of a big PowerPoint presentation. And let me share my screen. As I mentioned, this is going to be divvied up into a few chapters actually. So we'll start by talking about influenza. So influenza in itself is an infection, which creates breathing problems. It's highly contagious. It increases morbidity and it decreases mortality. It has a peak season of approximately December to February, and it has a few different types. It has influenza A, B, C, and D, and then there are actually subtypes about influenza A, B, C, and D, especially in influenza A, such as H1N1, and those subtypes are because of the antigens that are associated with those serotypes. So influenza A is the most common and it's the strongest, otherwise known as the most virulent. And every year that influenza A virus mutates. So no one really has immunity to influenza A just because of prior exposure. There are pandemics associated with influenza A, which is worldwide spread. There are epidemics, which are localized spreads, and transmission occurs with influenza A because of infected droplets. 1 day before your onset of symptoms is when people are contagious. So they can actually bring in the virus, be contagious, and not have any symptoms for about a day or so. Once those symptoms start, there's about a 5 to 7 day duration of the symptoms, depending upon the immune system of what is now the host or the infected person. So there are different manifestations, and the manifestations you can also see in Lewis on table 26.3. So there is an abrupt onset. Usually it's about 7 days of chills, fever, myalgia, muscle aches, headache, cough, sore throat, and fatigue. Complications of this particular infection include pneumonia, which is why we have a linked that's why pneumonia follows this presentation in the slides. Ear and sinus infections are also occur as a complications. And in older adults, they really do get weak and they get very lethargic when they have the flu, influenza. Diagnostic studies, how do we determine somebody's got influenza? We'll do a history and physical and H&P. We'll look at prevalence in the community from public health data that's coming out. Public health does track this. We'll take a look at their sputum. We also can do a swab, which we take a special instrument. It looks a lot like a Q-tip, and it goes all the way back into the nasopharynx to do a viral culture. Some of those can be done as a rapid, and some of those are done over the course of a couple of days. Depends upon what your facility's got available to them. And so management of this, what are we doing for these people? First of all, what we're going to be highly encouraging is vaccination, because that's going to prevent a full-blown infection. If the immune system can recognize that there's the latest and greatest, hottest, newest influenza A virals present in the body, and the immune system is attuned to that, goes in, takes it out. But because these viruses mutate so quickly throughout the year, we actually do need an annual vaccine. Takes about 2 weeks for antibody production, and We advocate that vaccine for anybody who's greater than 6 months old, and especially those who are high risk. So healthcare workers and long-term care residents. Healthcare workers, not because we have reduced immunity and it's going to take us out, although it can, and influenza going through a staff is horrible and creates a lot of sick leave and creates a lot of strain on the remaining staff, but also so that we don't pass it along to our clients that we're serving. So like I had said earlier in the first slide that I had talked about, you can have influenza A for a day or maybe even two and not even know that you have any symptoms. And you could be passing that, you are infectious to other people, even though you have no symptoms. If the person is infected with influenza, then we're going to be going with symptom relief and preventing secondary infection. So we're going to be encouraging rest, fluid intake. We want to keep everything nice and thin. Antipyretics and analgesia. So antipyretics to help with any sort of fevers, and analgesia to help with those muscle aches. Nice part is a little bit of Tylenol can help both of those. And antivirals, there are antiviral medications that are available if you catch your symptoms early enough and you get a fast enough result on your viral test. If you catch your virus, your viral infection within 1 to 3 days, there are antivirals that will shorten the duration of symptoms and reduce the risk of complications. So this is it for influenza. I'm going to stop sharing my screen, and I'm going to start the pneumonia chapters just after I finish this. Please refer back to Lewis. As you saw in the presentation, there's a fair amount of tables that are important to influenza, to your learning about influenza. Please share any questions that you have with me, either via email or bring them to class. And I will see you in pneumonia. Well, not in pneumonia, but for the pneumonia presentation.